Hello and welcome to my continuous assessment presentation for the movement analysis and biomedical aspects module. The aim of this assessment was to assess an individual's movement competence and identify potential risk of injury, and doing this over 4 movement analysis tests. The sport of choice in this assignment was rugby sevens, which can be thought of as a shorter, more high-paced format or derivative of the traditional rugby union. The subject used in this test was a 22-year-old male who is part of a full-time rugby sevens academy and has 5 years of resistance training experience. His injury history included 2 grade 2 left hamstring strains, both in 2022, and 1 grade 3 right ankle ATFL, which occurred last year. Just a needs analysis for rugby sevens. The sport requires a player to have a high anaerobic capacity. The game is in nature very stop-start, where players are required to cover well over 100 meters per minute and at a high intensity with work to rest ratios of 0.71 to 1, ball in play time tending to be about 40 seconds before the players get any rest. The game also involves multiple matches or games per day. So players will go through 3 to 4 games in a day over a 2 or 3 day period, covering almost 1.5 kilometers per game. So the ability to be able to go, stop, and go again becomes very important. Power in rugby sevens is specifically important, more so really than strength, because of the very short contact time or fight time in sevens, and a high number of one-on-one collisions. So if you are able to win a collision, whether it's a ball carry or a tackle, in a short amount of time and perhaps beat a defender or stop a defender, that becomes a very useful asset to the team. Speed and change of direction. So acceleration is very important. As I just mentioned, being able to beat a defender, if you are quick in a one-on-one over 5 meters, and also on defense, if you're getting up off the line, being able to shoot up and make a tackle quickly and put the opposition player under pressure, that is very, very important in sevens. And then also maximum velocity, so top end speed. There's a lot of line breaks in sevens with playing on a big field with only 7 players in a team. That leads to a lot of line breaks. So if you're able to break the line and go all the way to score, or perhaps if you can chase someone down who has just made a line break. And then lateral movements. The game, there's a lot of sidestepping, changing of direction. You have to move left and right in order to tackle. So being strong in the groins and being able to move quick laterally becomes vital. Then just specific movements. A lot of rugby sevens or rugby in general happens low to the ground. Tackling, cleaning out in rucks, all of that stuff is very low to the ground. So being able to drop your hips and get low and be powerful in a low position. And then secondly is being able to jump. So in sevens, all players pretty much need to be able to jump, whether you are receiving a kickoff or making a kickoff, or whether you're in a line out. You need to be able to jump and be quick on your feet up in the air. And then just specific skills to the game. You have contact skills, actually being able to make a tackle, being able to carry a ball into contact, being able to fight through a small gap, and then non-contact skills such as catching a ball, passing, and kicking if you happen to be a kicker. Also, some players need to throw into a line out. So the rationale behind the movement screens of choice. So I've chosen the hip rotational test. That's both internal and external. The reasons is that tight hips tend to lead to other injuries. So tight hips have often led to lower back injuries, groin injuries, adductors, even gluteal muscular injuries. So the hip almost seems to be a an area that has a knock-on effect in terms of injuries. If there's tightness in the hips, other areas or other muscles take strain. And rugby, by nature, looking at kicking, you're swinging your legs across your hips, twisting and turning in contact, changing direction, as I've already mentioned. All of that involves hip rotation, both internal and external. The hamstring popliteal test. This is a nice test because it uses the hamstrings or stretches the hamstrings to give an indication of the player's range of motion about their knee and hip joints. And I'm particularly interested in the knee joint because in sprinting, any sport that involves a lot of sprinting, we see a number of hamstring injuries, and this is no different in rugby sevens. It's a common injury that has a high rate of re-injury, and often due to poor running mechanics, players at a young age, as this player is in this test, 22, players at a young age that haven't necessarily developed proper running mechanics tend to overextend their strides and pick up hamstring injuries. So this test will show us if the hamstrings are tight, in which case a subject may be at risk of a sprinting related injury. The tuck jump test, this is great for evaluating a player's knee positions when absorbing force during a landing or exerting force in jumping. Rugby, as I mentioned, contains a lot of jumps and side steps, so there's a lot of force on the knees, and we need to be powerful in that area. It also tests the player's power and an element of fatigue. This is a nice aspect of a dynamic test, that it brings in an element of fatigue. The upper extremity shoulder stabilization test. The shoulder is probably the most common injured body part in rugby. All the tackling, the ball carrying, falling to ground, the shoulder rotates a lot and takes a lot of strain. This test, although it doesn't necessarily test strength, it tests the shoulder stability and almost the stability of the whole shoulder complex, including the scapula and other small muscles around it. And again, a dynamic test brings in an element of fatigue. The results of the tests, if we start with a hip rotation test, we see internally that both left and right hips not much different and within a normal range. But externally, although both legs are both at 41 degrees, this is a bit below the norm. So that's a slight concern on the external angle of hip rotation that we will need to address. The hamstring popliteal test, what I am surprised about is that given the athlete's 2 hamstring injuries on their left hamstring, both hamstrings seem to be equally flexible, but in saying that, both are well below a normal range. And this is concerning given the nature of hamstring injuries in sprinting related sports and high occurrence of re-injuries. This athlete's hamstring is a point of concern. The tuck jump test on the right hand side of the screen, the player did quite well in this test. Not too many areas that were flagged. A 0 indicates that the player passed that line item of criteria, and a 1 will indicate some degree of error. So the only 2 areas that picked up error was not landing in the same footprint. So the player was landing in a forward or back position every time. So not being able to exert his force straight up, force slightly going forward or backwards, and then excessive landing contact noise. So this generally comes down to a low knee flexion angle. That's on the landing when you're absorbing force. And this could be attributed to the grade 3 ATFL injury in the player's right ankle. So those 2 areas have been flagged. And on the shoulder stability test, we see a very normal, or up on the upper end of a normal range, which is the average of all 3 trials. However, I would potentially expect a rugby player to do slightly better. So I would expect a rugby player, given the nature of the game and how important your shoulders are, to perhaps exceed the normal range. So the weekly program that the athlete is training on 3 days a week. Is in a team environment, so there have only been a couple of exercises that have been tailored for his specific needs. So on a Monday, on the upper body day, we see shoulder taps that are brought in. This is similar to the stabilization test, but great for shoulder stability and getting the player used to that movement. ab rollouts as well. On the extension part of the ab rollouts, we are straining the shoulder joints, and when bringing the roll back in, the entire shoulder complex is being stretched there, and great for strength around there. And then shoulder press, just general shoulder strengthening, all the muscles around the joints, all getting strengthened on a Monday. On Tuesday, the players are doing lower body, and here we see a pigeon stretch, which I've brought in to address the lack of external hip mobility. So the pigeon stretch really gets the player into an external hip rotation, and over time this can become slightly elevated onto a bench or a box to just further increase that range or that stretch on the hip and the glute muscles. The box jump is great for exerting force, so to practice exerting your force directly up and not forward and back. Assisted Nordics are great for hamstring strength, and this then later becomes unassisted, just to make sure, even though this athlete does have quite tight hamstrings, just to make sure that his hamstrings are strong. And we see also with single leg RDLs, getting that lengthening range, that sort of eccentric motion on the hamstrings, that can then become elevated just to increase the sort of range of motion about the player's hamstrings. And then lastly, our drop squats are used for the player to almost become better at absorbing force, increasing his knee flexion angles and not being so quad dominant in his jumps, being able to activate the glutes, the upper hamstrings, all working together to absorb force. And then later on in the program, that can become a drop landing, which is just from a higher platform, and you can add weight to that. On Thursday, the players do full body. Here I've added banded leg raises as part of the warm-up. What I like about the bands is that the player can pull the band at his discretion and increase the stretch on his hamstrings. And we also see here single arm push-ups, medicine ball push-ups. So this is, although it stables the shoulder, it brings in an element of strength, and so too with dips. Dips are great. You get a lot of range of motion, a lot of tension in and around the shoulder over there. To conclude, I found the range of motion tests quite useful in flagging injury risk. We saw how the player's hamstrings were noticeably short or tight, and that he might be at risk of injuring his hamstrings during sprinting. And given the fact that he has already got a hamstring injury, he's probably at higher risk of re-injuring. And then the dynamic tests are very useful in assessing movement stability. We saw the knee flexion angle to be quite low when absorbing force. We've been able to address that, and then also that the player was exerting force not in a straight vertical line, that he was moving a bit forward and back. Going forward, I think you can incorporate more than just these 4 tests to get a better picture or a whole holistic view. I think there are elements of the functional movement screens, especially the overhead squat, that are great to use, and even some posture analysis I think would be great to add to this. And then to be rugby specific, I would love to see a bit more neck strength in testing, because this the neck is under a lot of pressure in contact situations. These are the references I've used, and thank you very much for listening to my presentation.